I went on Facebook. I asked you to ask me questions so that I can come and answer you in a video. I didn't expect the responses that I got. There are so many, but I'm going to go through most of them. I'm going to select those which are not personal consultations, and then we're going to go through them. Now, like the first one, hello doctor, what's the difference between fibroids and endometriosis? Now, fibroids usually happen when you have a growth within your endometrial wall. Now, we have endometrial wall and we have endometrial lining. There's a difference between them in that every month, whatever you're losing in blood, the blood that you usually get is from the demolition of your uterine lining, not your wall. So we have the wall and we have the lining. The lining is what you usually lose after every cycle. That's what you usually get in the menses. Now, fibroids usually happen, it's a growth that usually happen, and we actually don't know what usually causes this. So they usually happen in between that wall. So either the first layer or in between or outside, or maybe there's something called pedunculated, where you find that it's like a fruit. So there is a stalk or a stem, and then we have like a swelling somewhere just hanging inside, and that's endometriosis. So it's not cancerous, it's just a growth, but it can be very destructive. It can destroy the shape of your uterus, it can do so many things, but that's a topic that I covered in a video, so you can check that on my YouTube channel. Now, endometriosis, now remember we mentioned about the lining, the blood that usually lose after every 28 days, that's from the wall. Now, this wall can grow any other place that is not the uterus. It's supposed to grow in the uterus, but then it can grow in other areas. So, like for example, in your abdominal cavity, and we talked about, I think I mentioned this on a video about retrograde menstruation. So the cells can grow, the lining can grow anywhere else apart from the uterus, meaning that after when you get your estrogen, when you are forming that lining inside your uterus, it's also forming another wall in other places that is not inside your uterus. So when you're shedding the blood during when you're not pregnant, so you need to shed the wall so that you build another one. So during this time, even the section that is outside will also start to shed off that blood, and the pain will come from now. This blood can pool in a place, and your cells, your immune cells, will try to come and try to fight off that. So you are going to get an inflammation there. That's when you're going to get that pain. Another question: what causes stomach bloating? That feeling of fullness even when one hasn't eaten. Now, I'm not going to delve into this because we have so many causes of that. Before you even ask, go see a doctor so that you can be able to narrow down, because we have so many causes. Like a person can ask you what's causing a headache. Headaches are caused by so many things, so you cannot narrow down to a specific cause. You have so many, so just go and see a doctor. Another question from Caroline: heart palpitations, is it a serious condition? Anything to do with the heart, anything to do with the visceral organs, the vital organs. We have the heart, we have your brains, we have your kidneys, we have your liver. They're very important. Anything to do with them is an emergency, and especially the heart, because you see, your heart is supposed to be normal and fit. Maureen is asking causes of hemorrhoids and treatments. We have, okay, actually, I have a video on this on my YouTube. You can go and check that, or you can just wait a little bit longer so that I make a little bit longer video detailed that will give you everything that you need to know about hemorrhoids. But before you get there, one thing you have to understand: hemorrhoids usually happen due to so many reasons, one of which is you being pregnant. There is a relationship between you being pregnant and getting the hemorrhoids. Now, hemorrhoids are very normal, everyone has them, but when they bulge, when they become a little bit bigger, that's when they become an issue, because everyone's supposed to have them. And something else interesting I know you might not be knowing is the blood that will come from the hemorrhoids that are damaged will come from the arteries and not the veins. And this is the reason why the blood that you usually get from the hemorrhoids are usually bright red. Hemorrhoids, one thing you have to understand is one, you are straining to pass your bowel. Two, and mostly when you are straining to pass your bowel, it's either maybe you're sitting down for too long, you are lifting heavy things, so you are straining your back there, or you're using the toilet that people usually sit on. I would prefer the one that you'll have to squat. It's better. We have the foods that you're eating. If you're sitting on your stool for too long, you are not passing your bowel. Maybe you don't want to use that washroom, the public washroom that you usually use in your workplace. So you want to go back to your house because you trust your toilet better, of which is something reasonable. But sitting on it for too long will increase the chances that now more water will be drawn from your stool and you're going to get hard stool, and now passing this will now start this constipation. So one thing you have to learn, there's several things I would advise you to do. One, don't sit on your stool for too long. If you feel that you need to go to a washroom, just go. Empty your bowels frequently. Second thing, make sure you are eating foods that contain a lot of fiber. We have two types of fiber. We have insoluble and we have soluble. So make sure you're incorporating foods that are that. Take a lot of water. And for the hemorrhoids, one of the treatment is just to sit down and watch, because sometimes they usually disappear, but sometimes they can become larger and troublesome, and sometimes they can become infected, and especially if they rupture. Now, in this case, several things can happen. They can be removed surgically, or your doctor might tie. Okay, I'll just use layman's language. They're going to tie off the hemorrhoids, the ones that have swollen, and because by the way we have 3 of them, so I think you can check on that video. So those ones which are big enough, they can be tied using a rubber band, and then it's going to strangle those hemorrhoids, and they are going to die off, and they are going to fall off. Lillian is asking what causes hairline loss and how can it be recovered. Now we have several things here, but I'm going to narrow down to the most common ones, one of which is gaining a lot of weight, insulin resistance. Have you heard me talking about acanthosis nigricans? We have a spike when it comes to, especially when you gain weight, you're going to increase the androgens in your system, and you're going to start losing your hairline because you have a lot of that. Now, mostly when you start getting testosterone, one of which is the major androgen, mostly this usually happens when you have insulin resistance, which usually come from you taking a lot of sugar and having that being stored frequently. Maybe you're overweight, or maybe you're obese, or maybe you have an issue with this sugar in your body. So if you have a lot of that, then your body will start increasing the amount of testosterone that you have, and this is a bad thing. Okay, every lady should have a certain amount of testosterone, but when it goes beyond a certain level, then you start getting those symptoms. You start losing your hair, you start getting beards here and there. You're going to lose your scalp hair, and also you start getting hair on your chest. You start, even your voice start deepening because of this. So what you need to do here, first of all, if you are overweight, make sure you drop your weight, because that's the major contribution. Now, for the others, we have so many causes. Like for example, you have hormonal imbalances, you have fibroids, you have so many things that can cause this. So if specifically it's about weight, it's high time you just go and drop that. Kindly discuss about stretch marks, kwa tummy, and how to clear them. Now, stretch marks usually form when you gain a lot of weight and then you lose a lot of weight, or maybe you lose a lot of weight from the original shape that you had, or you just gain a lot. What eventually happens, your skin contains proteins that we call collagen, and then we have elastin that makes your skin to be flexible and to be good. Now, if you gain a lot of weight, you're going to strain the structure of your skin, and some of those filaments that usually keep your skin in shape usually break, and when they break, they are going to look some other areas they are going to be saggy, and some other areas they are going to be the same thing that usually happen when you pull an elastic band. When you pull it beyond the elastic limit, it's going to break. This is exactly the same thing that usually happen. Now, for the treatment, you actually don't need to do anything, because it doesn't cause anything serious. Your skin will grow back, but then it will take time for that to disappear. But in case maybe you want to do that, we have some procedures, then you can check them. Have a video on my TikTok about that, then you can just go and check about the stretch. Actually, even on my YouTube, just go and check the video about stretch marks. You're going to see how we usually treat them, but you actually don't need to treat them at all. Please, can you explain the causes, prevention, and treatment of back pain? Usually, they differ. It might depend. You might be having an issue with your sciatic nerve. We have sciatic nerve. We have so many things that usually cause the pain from there, because that's a nerve passing close to where you have the discs from the column of your spine. So you have the spine, you have some discs in between. One of them can bulge, putting pressure on the sciatic nerve, and this is when you're going to start getting that pain. We have so many things that we need to learn about that, but then we have other causes, and that's why sometimes we really tell you to go and see a doctor, so that they can be able to evaluate exactly what's causing that. Because you have other causes, like you are close to getting your menses. When you're close to getting your menses, there is production of prostaglandins that usually initiate the contraction of the uterine wall to shed off the lining. Now, when this happens, your body might overproduce the prostaglandins, and some of the effects will be that. But then also when you're pregnant, progesterone usually leads to you getting like the muscles around your pelvic region to relax. Now we have the connection between the bones and other bones and the flesh and bone. So the ligaments and also the tendons, they usually relax, meaning that the weight from your upper body is going to rest on your muscles, and this strain will cause the pain there. So we have several causes of the same. This usually happens when you get pregnant, when you have an issue with your sciatic nerves, when you have overworked, maybe you've been bending for long, so you have some issues there. Also, when you're close to giving birth, because your body is relaxing. Also, you have several causes, so I would prefer you go see a doctor for the same. I think I'm going to you need to see a doctor for this quite sometimes. Like you're going to see what effects comes with DIPO. We have so many causes. You need to check a video about that on my YouTube and also on TikTok. You can just go and check for that. I gave a lot of information there. You can just go and check that. Some of the questions are kind of repeating themselves, so I'll try to just keep around them and answer them in a different video, because as you can see, people asking the same question. There are several, so I'm going to just combine them and just give you information about them. What causes recurring headaches? And I've talked about this, so I think you should just go and check that on my YouTube. What causes ringworms and how to get rid of them? Now, we have so many causes. I made a specific video about the fungal infection you usually get on our skin, so one of which is this. Now, tinea causes this, so it's a fungal infection, so you need to go and have that treated with antifungals, and it can be very stubborn, so your doctor might end up giving you antifungals to swallow, like glycofulvin. We have terbinafine, my favorite. Glycofulvin is good because it doesn't give your liver hard time, so it's very good for your body, and it's good for taking over a long period of time. So I think you can just go and check that. Also, you have topical application of things like we have ketoconazole. We have I'm going to use brand name here. We have Protein B, we have clotrimazole. There are several, and I usually prefer Protein B because it contains betamethasone, meaning that it's also going to be anti-inflammatory. So in case maybe you have that infection there and you have pain, or maybe you have inflammation, it's also going to take care of that. So it's good. And actually combine the pills that you usually swallow, the antifungal drugs, and also the topical application for the same. What causes severe hot flashes that last over 1 year and resisted all the drugs? Now, most of the hot flashes usually happen because of less estrogen in your body. So if you have less of that, then you're going to have issues. And this is the reason when you get to your menopause, you start getting this, because you don't have enough of that. So the drugs might be treating the symptoms. Know exactly what's causing the hot flashes, what's causing your estrogen to go low, and then you fix that. Because if you continue taking drugs, and I'm thinking that the drugs that you're taking, you're supplementing your body with the estrogen containing pill. So if you have that, then it means that you're fixing the cause. But then maybe if you saw a doctor and they give you the pills, it means that maybe the cause of your low estrogen is not something that you can fix, so you'll have to live with the pill. So it's good to you. Just go back to your doctor, just have a confirmation from them, just try to narrow down to what is exactly causing this. If you have overproduction of testosterone, or maybe there's something else going on, then they need to narrow down to that, and then you fix that. That's the only time you're going to go off the pills. Now, before you even go far, there will be instances when your doctor will tell you that now this condition is you're going to adjust your lifestyle. And it means that this is something that's either chronic, or it's going to take a really long time before you heal, or you're going to take care of that condition for the rest of your life. Like for example, take something like eczema. Most of the causes are usually not known, so we don't actually know. So one thing you need to adjust is to make sure that you don't get an allergen that will cause a flare on your skin. Avoiding that is something that we call now adjusting your lifestyle. You'll have to make sure that you don't come into contact with something that will cause a reaction on your skin. That's the lifestyle. When you have diabetes type 2, when you have, that's already advanced, when you have diabetes type 1, you'll have to adjust your lifestyle to match the best outcome from your practices, because if you're taking a lot of sugar, then you need to cut that completely and stay for long. If you have type 1, you'll have to use insulin all through, because your body cannot be able to provide that, so you'll have to provide that for the rest of your life. We have something like HIV. If you have HIV, you'll have to deal with the ARVs for the rest of your lives if you want to improve the quality of your life. So if your doctor at any point tells you that you'll have to adjust your lifestyle, most probably they mean that you need to take care of this beyond the hospital. So it might be something that you're going to stay with for long. What causes hormonal imbalance, and can it be completely cured? Now, you have so many causes, and I'm not going to talk about anything here. Just go and watch a video about the same on my YouTube channel. I have a video on hormonal imbalances. I think it's around 20 minutes, so it's a lot of information packed there. So just go there, watch that video, and don't be in a hurry because it's a long one. Can extremely prolonged cramping cause barrenness, as they say, and be not better? If I'm not wrong, I really suffer Kia Hosi and Amore. Now, the cramping that you're talking about here might be because you have something underlying. So this is a symptom pointing to something else. Now, it might be a cause, it might not be, because now, in case maybe you have endometriosis, it might be an issue to your body. Yes, the pain will be there, but then depending on the level of the infection that you have or the condition that you have, depending on the level, you might be not barren, you might be infertile. I'm not going to use barren here. So you might be infertile or fertile, because now the only thing sometimes when it comes to endometriosis, apart from now maybe you might be having other issues in your system, if it's purely endometriosis and it's not that advanced, you might be able to get pregnant comfortably. The only thing that you're going to have is you're going to have a lot of that pain. But then in most instances, when you have endometriosis, you'll have to have that removed for you to resume your life normally, or maybe you just start using the drugs, because some of those drugs usually limit how much of that pain you're going to get. Some of them will be just painkillers, others will be just hormonal therapists that will make sure that maybe you're halting, like progestin based, they're going to halt or maybe trick your body, so you're not going to get the menses, or maybe you're going to be reduced along those lines. So depending on exactly what's causing your cramping, you might be fertile or infertile. So I can't actually tell from that statement. Hello doc, can we talk about genetic incompatibility? It's a least talked topic. Now this one, we have so many things that you consider when it comes to now the genetic compatibility. So you have so many things, but then I'm going to narrow down to one thing that you're seeing about every now and then. Now, if you are a lady, you are rhesus negative, you really need to know this. Anytime you become pregnant, you are going to receive a shot for something that we call ROGAM or anti-D to prevent your body from attacking your pregnancy. Because when you're rhesus negative, chances are your body will sense during the first birth. During the first birth, your body will sense that there was a foreign antigen, that's now the baby, that contains the rhesus positive. No, and I'm talking about, let me be more specific. You are rhesus negative and your husband is rhesus positive. You are rhesus negative as a lady, your husband is rhesus positive. You're going to have a rhesus positive baby. So this one will create what we call sensitization, meaning that next time when you become pregnant from the same guy, there will be an attack that will be now from your system to the baby. So you're not going to give birth, you're going to have miscarriage or maybe a stillbirth most of the time, depending on how strong the reaction was. Now it's very important for you to always make sure that at around week 28 you have a shot for the same if you are rhesus negative, and after delivery, before 72 hours are over, you have a shot for the same to make sure that your body is not sensitized, so that you can continue giving birth all through. Other things are like screening for sickle cell anemia. We have so many things that can be checked for compatibility with your partner. So today I just decided to mention that because that's very important. It's something that can be within your control. Others cannot. Others you are not able to actually know. So that's one thing that you can actually control. If you become pregnant with rhesus negative, always make sure you have a shot for the same. What causes yeast infections, recurrent, and what medicine can cure it completely? I'm actually not going to talk about this so much. I have a video on this, the recent one. Just go to my YouTube and watch that video. It's actually 28 minutes, so make sure you watch that video. It's going to give you all the information that you need. Some of my questions, I'm going to skip them because some of them are just repetitions. What causes back pain in women? I just made an explanation about the same. Are painful menses the cause of barrenness? Like I talked about, the pain usually experienced maybe due to something like maybe you have fibroids, or maybe, okay, let me just have, like, I know I answered this question, but let me give some more perspective. The painful menses can be caused by several things, like we mentioned, one of which is endometriosis. We also have fibroids. We have hormonal imbalances, whereby you find that at a certain month, you're going to overproduce, okay, not even, let me just go a little bit back. You have prostaglandins. You've overproduced that. You're going to have loose stool. You're going to have bloating. So issues when it comes to your digestive system. Overproduction of the same will create other problems, because if you overproduce prostaglandins, it's going to cause pain all over because it's going to spill over. Now, prostaglandins during this time when you're about to get your menses, supposed to only work locally on your endometrial wall to shake off the uterine lining. So if you overproduce, that's going to have effect on other areas. So you have so many causes. So it can cause, depending on what's causing that pain, you can be infertile, or maybe you can be fertile, yes, but it's only the pain that's affecting you. Good morning. What's the remedy for fibroids? I talked about the same. I have a video on this. You can just go and check that on my YouTube channel. Can pelvic ultrasound detect if your one has cysts? Yes, it does actually. One thing you have to understand, anything when it comes to your gonads, ladies, between where you have your reproductive system, men, the same. You're not supposed to have any radiation imaging around that area because it can endanger your eggs. So it's very, very sensitive area. So ultrasound is what is usually used most of the time. So it can check that. It can be able to detect that. So actually most of the time that's what is usually used. What causes erectile dysfunction and how can it be cured? I have a video on this loading, so I'm going to talk about this because I discovered I'm so much focusing on ladies, so I'll try to also focus on men. So just make sure you are subscribed, by the way. What causes chronic diarrhea and is it treatable? It will depend with what's causing this. If you've been using antibiotics for long, it means that now you've killed so many of that normal flora, and especially if you're using the broad spectrum antibiotics, they're going to kill even the normal flora that are supposed to keep your area intact. They're supposed to be there along your gut. So if you kill them, either the few that will be left will overgrow, so you're going to have an infection there, or you have an introduction of a new strain of bacterial or fungal elements, and they're going to make sure that you're going to have the diarrhea that can last for really long. Now, if you are not taking antibiotics, maybe other issues, maybe you have irritable bowel syndrome and other conditions, you need to see a doctor to narrow down to exactly what's causing that. But if you are taking antibiotics, one thing I would recommend for you to do is to make sure that you're taking probiotics. They usually help. So go to the pharmacy, buy them, eat them. You can also even buy yogurt that has they usually come with the probiotics. Take that, it can help. When passing out urine and it forms like omo is added on it, what is the cause of that? I have a very interesting video about this one, so you'll have to keep just make sure you stay around. Morning dog, what causes goiter? I have a video on that also, so just make sure you're staying around. Is family planning dangerous? No, it's not. It will depend. Now, before any drug is given to you at any given moment, any drug, this is something that we should call clinical trials. Before you are given anything in form of medication, we have clinical trials that is, most of them usually start with the mice, and then they just go to our cousins, the monkeys. We have the chimpanzees, which are the closest to us. Before we even now start enrolling the drug, the same drug will be taken to a small population of people, let's say 20, and then after the results, if they are promising, then to a wider, then to a bigger, then to a bigger, so that we get to narrow down to how it affects people. Now, there is no drug that will act 100%. You're going to have some people that will react negatively to the same drug that is reacting positively to others, because our bodies are very diverse, they are different, and you might be one of those who are not as lucky. So that's why I say it will depend. Now some of them are very perfect. Even I've seen people using even those drugs that are already banned in some countries like Depom, and they're totally okay. We have others that will just use this and they start bleeding for long. Now, if you can bleed for like 1 full month, every day, you're going to start suffering from something like anemia. So you have so many conditions that can be caused by them. So it can depend with your body. So I don't have a straight answer to this. So it will depend with your body and how you're going to react with them. So yeah, I have copper IUD inserted. It's been a year now. There was a time when I could feel it stab my womb when I sit in a certain position. It's past now, but is it something to worry about now? One thing I would want to just tell you, like one of the things someone who replied here, just go see a doctor, have an ultrasound done so that they can check how it's staying like, so that if it's misplaced or maybe it just went out without you knowing, it can be maybe replaced or maybe readjusted depending on which is easier. Now if you don't have that, then they can insert a new one. If it's not in the right position, it's going to be readjusted. But in most cases, you're not supposed to feel it. If you have IUD anytime, you're not supposed to. Okay, you might feel it some few months, especially the string that usually dangle out of your cervix. That one, because it's usually hard during the initial days, but then it softens over time. So this one can give you some discomfort during the first few months, but then it disappears completely. So after that, then you're good to go.